Your child hits. Maybe they hit a sibling, a friend, or even you. It can happen suddenly and leave you feeling shocked, embarrassed, angry, or afraid. Many parents panic when they see aggressive behavior and immediately worry that something is wrong with their child or their parenting. Hitting can feel alarming, especially when it happens in public or at school. In this video, we are going to slow this down. We will talk about why children hit at different ages, what hitting really means, how to respond in the moment without making things worse, how to prevent aggressive behavior over time, and when hitting may be a sign that your child needs extra support. This video focuses on children between ages 2 and 10. Aggressive behavior looks very different at different ages. A 2-year-old hitting is not the same as a 7-year-old hitting. Understanding age expectations is critical. When parents expect emotional control that a child is not yet capable of, reactions become stronger and situations escalate. Hitting is not a moral failure. It is a behavior that communicates something a child cannot yet express with words or self-control. Children hit because they are overwhelmed, frustrated, scared, overstimulated, or lacking skills. Hitting is not a sign of a bad kid. It is a sign of unmet needs or underdeveloped skills. For children between 2 and 3, hitting is very common. Toddlers have big emotions and very limited language. When they feel angry, frustrated, or overstimulated, their body reacts before their brain can stop it. Toddlers are not capable of impulse control yet. Expecting them to know better is unrealistic. At this age, hitting is developmentally normal, though it still needs guidance. Between ages 4 and 5, children begin to understand rules, but still struggle with emotional regulation. Hitting at this age often happens during conflict, sharing issues, or when a child feels misunderstood. While hitting is less developmentally expected than in toddlers, it is still common, especially during stress or transitions. For children 6 and older, hitting becomes less typical and more concerning if it happens frequently. At this age, children usually have enough language to express frustration. Aggression may signal emotional overload, difficulty managing anger, peer conflict, or underlying challenges. This does not mean the child is bad, but it does mean closer attention is needed. Children hit for predictable reasons: frustration, lack of language, competition for attention, fatigue, hunger, sensory overload, or feeling unsafe. Many aggressive moments happen during transitions or unstructured time. Recognizing triggers helps parents intervene earlier. Hitting triggers adults because it violates safety and social expectations. Parents may feel judged, embarrassed, or afraid of long-term consequences. These emotions often lead to yelling or punishment, which can unintentionally increase aggression. Understanding your own reaction helps you respond more effectively. Yelling, shaming, threatening, or hitting back does not teach self-control. These responses increase fear and model aggression. Children learn how to handle conflict by watching adults. Aggressive responses from adults often reinforce aggressive behavior in children. When hitting happens, the first goal is safety. Calmly block the hit or move the child away. Use a firm but calm voice. Safety always comes first. Lower your voice, take a breath. Calm adults help children calm down. Children need clear boundaries. Say what is not allowed in simple language. Hitting hurts. Hands are not for hitting. Avoid long explanations in the moment. Short and clear is best. Aggression often comes from strong feelings. Acknowledge the emotion after safety is restored. You are very angry. Naming feelings helps children feel understood and reduces repeat aggression over time. Teaching during the meltdown does not work. This is where skills are built. Children need tools to replace aggression. Practice these skills during calm moments, not during conflict. Many aggressive behaviors are linked to physical needs. Hunger, fatigue, and overstimulation lower tolerance. Regular meals, snacks, sleep, and downtime reduce aggression significantly. Loud environments, excessive screen time, and chaotic schedules overwhelm children. Simplifying the environment helps reduce aggressive outbursts. Calm spaces support calmer behavior. Predictable routines reduce anxiety and aggression. When children know what to expect, they feel safer and more in control. Uncertainty often leads to aggressive reactions. Children learn how to handle anger by watching adults. Calm problem-solving, respectful tone, and repair after conflict teach powerful lessons. Modeling matters more than lectures. Occasional hitting in toddlers and preschoolers is common. However, frequent, intense aggression, especially in children over 6, is not something to ignore. Patterns matter more than isolated incidents. If a child over age 5 regularly hits, hurts others, cannot calm down, or shows aggression at school and home, it is important to seek support. Talking with teachers, pediatricians, school counselors, or child therapists can help identify underlying causes and provide strategies. Early support prevents long-term problems. Aggression is not something to punish out of a child. It is something to guide them through. Your role is not to eliminate emotion, but to teach safe expression. Skills develop over time with patience and consistency. Hitting and aggressive behavior are stressful, but they do not define your child or your parenting. With calm boundaries, emotional support, and realistic expectations, children learn safer ways to express themselves. Progress takes time. Better parents start with better understanding.